Are you preparing for the Nclex and feeling nervous about pediatrics? Don't worry, you're in the right place. In this video, we're going to cover 50 pediatric Nclex questions that you absolutely must know. But here's the best part, I won't just give you the answers. I'll walk you through detailed rationales and powerful strategies that will help you master these concepts and apply them on test day. Some of these questions are the exact type that students struggle with most, and by the end of this video, you'll know how to spot the trick, avoid the trap, and pick the correct answer every single time. So stick with me all the way to the end, because I've saved some of the most high-yield pediatric questions for the last, and you don't want to miss them. Question 1. A nurse is assessing a 9-month-old infant. Which developmental milestone should the nurse expect? A. Walking without support. B. Sitting without help. C. Speaking in short sentences. D. Drawing simple shapes. Answer. B. Sitting without help. Rationale: by 9 months, an infant can sit independently, pull to stand, creep, and respond to their name. Walking independently does not typically occur until around 12 to 15 months. Speaking in sentences and drawing occur much later, in preschool and school-age years. Strategy: when tackling growth and development questions, remember. Rule of thumb: major motor milestones progress head-toe, cephalocaudal. 6 months equals sits with support, rolls both ways. 9 months equals sits without help, crawls, pulls to stand. 12 months equals walks with help. Eliminate choices that are clearly too advanced for the age. Question 2. The nurse prepares to administer digoxin to a 3-year-old child. Which action is the priority? A. Give the medication with food. B. Check the apical heart rate for 1 minute. C. Ask if the child has eaten breakfast. D. Assess for diaper rash. Answer. B. Check the apical heart rate for 1 minute. Rationale: digoxin slows conduction through the AV node and can cause bradycardia. In pediatrics, the apical pulse must always be counted for a full 1 minute prior to administration. If the heart rate is below the safe parameter, usually 90 to 110 bpm for infants, less than 70 bpm for children, the medication should be withheld. Strategy: for medication safety questions, always think assess first, act second. Don't be distracted by irrelevant answers, like diaper rash. Question 3. A toddler is hospitalized for dehydration. Which finding is most concerning? A. Irritability. B. Dry mucous membranes. C. Sunken fontanelle. D. No tears when crying. Answer. C. Sunken fontanelle. Rationale: a sunken anterior fontanelle indicates severe dehydration and possible hypovolemic shock. While irritability, dry mucous membranes, and absence of tears indicate mild to moderate dehydration, a sunken fontanelle is more critical and needs immediate intervention. Strategy: on Nclex, when you see a list of symptoms, prioritize the one showing the most severe/late stage problem. Here, a sunken fontanelle means advanced dehydration, which is life-threatening. Question 4. The nurse cares for a 4-year-old with epiglottitis. Which intervention is contraindicated? A. Administer humidified oxygen. B. Keep emergency intubation equipment at bedside. C. Obtain a throat culture with a tongue depressor. D. Maintain the child in an upright position. Answer. C. Obtain a throat culture with a tongue depressor. Rationale: epiglottitis is a life-threatening condition caused by inflammation of the epiglottis. Using a tongue depressor can cause complete airway obstruction due to reflex laryngospasm. Instead, the nurse should keep the child upright, administer humidified oxygen, and prepare for emergency intubation or tracheostomy. Strategy: airway emergencies equals never put anything in the throat. Eliminate answers that could worsen the airway obstruction. Question 5. Which toy is most appropriate for a hospitalized 6-year-old? A. Rattle. B. Stuffed animal. C. Board game. D. Building blocks. Answer. C. Board game. Rationale: school-age children, 6 to 12 years, enjoy games with rules, problem-solving, and peer interaction. A rattle and stuffed animal are for infants/toddlers, while building blocks are more suitable for preschoolers. Strategy, match play to developmental stage. Infant sensory toys, mobiles, rattles. Toddler parallel play, push-pull toys. Preschool imaginative/pretend play. School-age competitive, rule-based games. Adolescent group activities, peer involvement. Question 6. The nurse is caring for a child with sickle cell crisis. Which intervention is the priority? A. Encourage ambulation. B. Provide oxygen. C. Apply cold compresses. D. Restrict fluids. Answer, B. Provide oxygen. Rationale, in a sickle cell crisis, red blood cells become sickle-shaped due to hypoxia, leading to vaso-occlusion and pain. Oxygen helps prevent further sickling and is the most urgent intervention. Cold compresses worsen vasoconstriction, ambulation is not appropriate in crisis, and fluids should be encouraged, not restricted. Strategy, always apply ABCs, airway, breathing, circulation, to pick the best answer. Oxygen addresses B equals breathing, making it priority. Question 7. A 5-year-old with leukemia is receiving chemotherapy. Which finding requires immediate action? A. Fatigue. B. Oral ulcers. C. Fever of 101 degrees Fahrenheit 38.3 degrees Celsius. D. Hair loss. Answer, C. Fever of 101 degrees Fahrenheit 38.3 degrees Celsius. Rationale. Children with leukemia on chemotherapy are severely immunocompromised, neutropenic. Even a low-grade fever can indicate life-threatening infection. Fatigue, oral ulcers, and alopecia are expected chemotherapy side effects and not immediately life-threatening. Strategy, on Nclex, infection in an immunocompromised child is always priority, more urgent than pain, fatigue, or psychosocial concerns. Question 8. The nurse is caring for a newborn with a cleft palate. What is the best feeding method? A. Regular nipple bottle. B. Cup feeding. C. Specialized cleft palate nipple. D. Breastfeeding only. Answer, C. Specialized cleft palate nipple. Rationale, infants with cleft palate cannot generate enough suction for normal nipples or breastfeeding. Specialized bottles and nipples are designed to allow milk flow without suction. Cup feeding may be an option later, but not initially. Strategy, think safety plus nutrition. Eliminate options that fail to address the infant's structural feeding challenge. Question 9. Which action should the nurse take first when a child has a seizure? A. Place a tongue blade in the mouth. B. Turn the child on the side. C. Restrain the child's arms. D. Call the healthcare provider. Answer, B. Turn the child on the side. Rationale, turning to the side prevents aspiration and keeps the airway patent. Tongue blades and restraints can cause injury. Calling the provider can wait until the child is safe. Strategy, for seizure management, always remember. Safety first. Airway protection. Nothing in the mouth. Call provider after stabilizing the child. Question 10. A nurse teaches a mother about iron-rich foods for her 2-year-old. Which food is best? A. Milk. B. Apples. C. Chicken. D. Rice. Answer, C. Chicken. Rationale, chicken provides heme iron, which is easily absorbed. Milk should be limited because excessive milk intake can cause iron deficiency anemia. Apples and rice contain minimal iron. Strategy, in nutrition questions, remember that heme iron, meats, poultry, fish, is more bioavailable than non-heme iron, plants. Avoid trick answers like milk, which is commonly overconsumed by toddlers but not iron-rich. Question 11. A 15-month-old is in the clinic for immunizations. Which vaccine is appropriate at this age? A. MMR, measles, mumps, rubella. B. Hepatitis B number 3. C. Varicella number 2. D. Influenza nasal spray. Answer: A. MMR, measles, mumps, rubella. Rationale: children receive their first dose of MMR at 12 to 15 months. Hepatitis B number 3 is already completed by 6 months. Varicella number 2 is not due until 4 to 6 years, and influenza nasal spray is approved for children greater than or equal to 2 years but is not a routine milestone at 15 months. Strategy: when Nclex asks about immunizations, remember. By 12 months, HIB, PCV, MMR number 1, varicella number 1, Hep A start. Preschool, 4 to 6 years DTaP number 5, IPV number 4, MMR number 2, varicella number 2. Eliminate answers that are too early or too late. Question 12. A 7-year-old with acute rheumatic fever has migratory joint pain. Which intervention is most appropriate? A. Apply cold packs. B. Give scheduled aspirin. C. Encourage bed rest only. D. Restrict fluids. Answer: B. Give scheduled aspirin. Rationale: rheumatic fever is an inflammatory disease that can follow untreated strep throat. Aspirin is used, in children only for rheumatic fever and Kawasaki disease, to reduce joint pain and prevent heart complications. Cold packs may give temporary relief but do not treat inflammation. Bed rest is recommended for carditis but not for joint pain alone. Fluids are not restricted. Strategy: on Nclex, ask, which option addresses the root cause? Here, aspirin reduces inflammation, the actual pathology, while cold packs just manage symptoms. Question 13. A nurse assesses a 2-year-old with suspected autism spectrum disorder, ASD. Which finding is most typical? A. Plays interactive games with peers. B. Limited eye contact and speech delay. C. Uses sentences with 3 to 4 words. D. Enjoys pretend play. Answer: B. Limited eye contact and speech delay. Rationale: ASD often presents before age 3 with impaired social interaction, delayed language development, repetitive behaviors, and restricted interests. A toddler with ASD may avoid eye contact, not point at objects, or prefer solitary play. Options A, C, and D describe normal social and communication skills that are usually absent in ASD. Strategy: for psychosocial/developmental questions. Identify expected milestone versus red flag. A 2-year-old should speak in 2 to 3 word phrases, play parallel, not group, games, and begin pretend play. Lack of these is concerning. Question 14. The nurse cares for a child with suspected intussusception. Which finding is most characteristic? A. Ribbon-like stools. B. Currant jelly stools. C. Clay-colored stools. D. Watery stools with mucus. Answer: B. Currant jelly stools. Rationale: intussusception, telescoping of the intestine, leads to bowel ischemia, producing stools mixed with blood and mucus, described as currant jelly. Ribbon-like stools suggest Hirschsprung disease, clay-colored stools suggest biliary atresia, and watery mucus stools suggest infections. Strategy: Nclex loves classic symptom disease pairings. When you see currant jelly stools, think intussusception without hesitation. Question 15. A 4-year-old with nephrotic syndrome is hospitalized. Which intervention is most important? A. Encourage high-sodium diet. B. Monitor daily weight. C. Limit protein intake. D. Promote increased fluids. Answer: B. Monitor daily weight. Rationale: nephrotic syndrome causes massive proteinuria, hypoalbuminemia, and severe edema. Daily weight is the best way to track fluid retention or loss, more accurate than INO. Sodium should be restricted to reduce edema, and protein intake is usually normal to high unless kidney function declines. Strategy: for fluid imbalance disorders, renal, cardiac, liver, always prioritize daily weights over INO, this is the gold standard. Question 16. The nurse cares for a child with Kawasaki disease. Which treatment is expected? A. Intravenous immunoglobulin, IVIG, and aspirin. B. Long-term corticosteroids. C. Broad-spectrum antibiotics. D. High-protein diet. Answer: A. Intravenous immunoglobulin, IVIG, and aspirin. Rationale: Kawasaki disease is a systemic vasculitis that can lead to coronary artery aneurysms if untreated. Standard treatment is IVIG to reduce immune inflammation plus aspirin to prevent clotting and reduce fever. Corticosteroids and antibiotics are not primary treatments. Strategy: memorize hallmark pairings. Kawasaki IVIG plus aspirin. Rheumatic fever antibiotics plus aspirin. Epiglottitis airway plus antibiotics, no throat swab. Question 17. A nurse assesses a 5-year-old with suspected meningitis. Which finding is most concerning? A. Positive Brudzinski sign. B. Sensitivity to light. C. Decreased responsiveness. D. Headache. Answer: C. Decreased responsiveness. Rationale: altered mental status signals increased intracranial pressure, ICP, or severe infection, which can rapidly lead to herniation. Positive Brudzinski, neck pain when flexing, photophobia, and headache are expected findings but less immediately life-threatening. Strategy: in neuro questions, always rank LOC changes as the highest priority, they trump fever, pain, or other neurological signs. Question 18. A 10-year-old with type 1 diabetes has blood glucose of 40 mg per deciliter. Which food is best to give first? A. Half a cup of orange juice. B. Cheese and crackers. C. Peanut butter sandwich. D. Chicken and rice. Answer: A. Half a cup of orange juice. Rationale: a glucose level of 40 mg per deciliter indicates severe hypoglycemia. Immediate treatment is giving a fast-acting carbohydrate, juice, candy, glucose tabs. Protein and fat foods, like peanut butter or cheese, help stabilize blood sugar after it rises but are not fast-acting. Strategy: apply the 15-15 rule. Give 15 g rapid sugar recheck in 15 minutes, repeat if still low. Eliminate slow-absorbing foods when hypoglycemia is urgent. Question 19. Which finding in a 4-year-old with cystic fibrosis requires immediate intervention? A. Bulky, foul-smelling stools. B. Persistent cough with thick sputum. C. Oxygen saturation of 88%. D. Clubbing of fingers. Answer: C. Oxygen saturation of 88%. Rationale: an O2 sat less than 90% means hypoxemia, which is life-threatening and requires immediate action, oxygen therapy, airway clearance. Bulky stools and thick sputum are expected due to pancreatic and lung involvement. Clubbing indicates chronic disease but is not acute. Strategy: always prioritize ABCs. Even in chronic disease, acute airway/oxygenation problems outweigh long-term expected findings. Question 20. A nurse is preparing discharge teaching for the parents of a 3-year-old with a new tracheostomy. Which instruction is most important? A. Teach how to suction the trach at home. B. Encourage daily swimming for lung health. C. Use cotton swabs to clean inside the cannula. D. Replace ties every week. Answer: A. Teach how to suction the trach at home. Rationale: the greatest risk for a child with a tracheostomy is airway obstruction. Parents must know how to suction properly and safely. Swimming increases aspiration risk and is contraindicated. Cotton swabs can leave fibers in the airway, and trach ties must always remain secure, not changed weekly. Strategy: when teaching parents about trach care, always prioritize airway clearance and emergency management over hygiene or long-term care. Question 21. A 6-month-old is admitted with bronchiolitis due to RSV. Which intervention is the priority? A. Encourage oral feeding. B. Keep child in a flat supine position. C. Monitor oxygen saturation continuously. D. Administer cough syrup. Answer: C. Monitor oxygen saturation continuously. Rationale: RSV causes airway obstruction and respiratory distress. Continuous pulse oximetry ensures early detection of hypoxemia. Oral feeding can increase aspiration risk when the child is in distress. Supine positioning worsens breathing, upright positioning is best. Cough syrup is not recommended in infants. Strategy: always use ABCs. With RSV/bronchiolitis, the main risk is respiratory compromise, so monitoring oxygenation is top priority. Question 22. A nurse is teaching parents about safety for their 18-month-old toddler. Which statement indicates correct understanding? A. We will keep all small objects out of reach. B. We can give him a pillow for comfort while sleeping. C. He can sit in the front seat if he is in a car seat. D. We will store cleaning products in a low cabinet. Answer: A. We will keep all small objects out of reach. Rationale: toddlers are at high risk for choking and aspiration, so small objects must be removed. Pillows are unsafe for children less than 2 years, SIDS risk. All children must ride in the back seat in a car seat. Cleaning products must be locked and kept out of reach. Strategy: in safety questions, look for the option that prevents the most immediate, common risk: choking, poisoning, burns, drowning. Question 23. A 5-year-old with congenital heart disease develops polycythemia. What is the underlying cause? A. Increased red blood cell destruction. B. Chronic hypoxemia stimulating erythropoiesis. C. Excessive iron intake. D. Bone marrow suppression. Answer: B. Chronic hypoxemia stimulating erythropoiesis. Rationale: in children with cyanotic heart defects, chronic hypoxemia stimulates the bone marrow to produce more red blood cells, polycythemia, in an attempt to carry more oxygen. This increases blood viscosity and stroke risk. Strategy: understand compensatory mechanisms: chronic hypoxemia, polycythemia, chronic anemia, tachycardia. Nclex often tests cause and effect like this. Question 24. A school-age child with sickle cell anemia reports severe pain. Which intervention should the nurse perform first? A. Encourage fluids. B. Administer prescribed opioid. C. Apply cold compresses. D. Massage the affected area. Answer: B. Administer prescribed opioid. Rationale: pain in sickle cell crisis is caused by tissue ischemia from sickled cells. The priority intervention is opioid analgesics for pain relief. Fluids help but take longer. Cold and massage worsen vasoconstriction and occlusion. Strategy: in pain management, Nclex tests if you recognize when pain relief is the priority versus other supportive measures. Here, pain equals tissue ischemia, treat immediately. Question 25. A 2-year-old is brought to the ER after ingesting an unknown amount of acetaminophen. Which lab should the nurse expect to monitor most closely? A. BUN and creatinine. B. Liver function tests. C. CBC. D. Blood glucose. Answer: B. Liver function tests. Rationale: acetaminophen overdose causes hepatotoxicity, so ALT, AST, and bilirubin must be monitored. N-acetylcysteine, Mucomyst, is the antidote. Strategy: always connect the toxin with the organ it affects. Acetaminophen liver. Aspirin bleeding, acidosis. Lead neuro, anemia. Question 26. The nurse is caring for a child with spina bifida and a myelomeningocele sac. Which intervention is the priority? A. Place the infant prone with a sterile moist dressing over the sac. B. Cover the sac with dry gauze. C. Place infant in supine position with diaper. D. Begin oral feeding immediately. Answer: A. Place the infant prone with a sterile moist dressing over the sac. Rationale: a myelomeningocele exposes the spinal cord and meninges, putting the infant at risk for infection and injury. The sac should be kept moist with sterile saline gauze, and the infant should be placed prone to avoid pressure. Supine position and diapers increase risk of rupture and infection. Strategy: in congenital defect questions, prioritize infection prevention plus protection from injury. Question 27. The nurse assesses a 4-year-old with suspected Wilms tumor. Which action is most important? A. Palpate the abdomen gently. B. Avoid abdominal palpation. C. Assess urine output hourly. D. Monitor blood glucose. Answer: B. Avoid abdominal palpation. Rationale: Wilms tumor is a kidney cancer. Palpating the abdomen can cause tumor rupture and spread of cancerous cells. Nurses must post a sign at the bedside: do not palpate abdomen. Strategy: Nclex loves this. If the stem says Wilms tumor, the correct answer is always avoid abdominal palpation. Question 28. A 12-year-old is admitted with diabetic ketoacidosis, DKA. Which intervention is the priority? A. Administer 4 insulin. B. Start 4 fluids with normal saline. C. Give subcutaneous glucagon. D. Encourage oral fluids. Answer: B. Start 4 fluids with normal saline. Rationale: children in DKA are severely dehydrated due to osmotic diuresis. Fluid resuscitation is always the first step before insulin. Giving insulin before fluids can cause shock and cerebral edema. Glucagon treats hypoglycemia, not DKA. Strategy: in metabolic emergencies, ask, what fixes the life-threatening issue first? Here, dehydration, circulation, is more urgent than hyperglycemia. Question 29. A 7-year-old with acute glomerulonephritis has hypertension. Which medication should the nurse anticipate? A. Furosemide, Lasix. B. Aspirin. C. Albuterol. D. Insulin. Answer: A. Furosemide, Lasix. Rationale: acute glomerulonephritis causes fluid retention hypertension. Diuretics help lower blood pressure and relieve edema. Aspirin is avoided, bleeding risk with renal impairment. Albuterol and insulin are unrelated. Strategy: link the cause-effect treatment, renal inflammation, fluid overload, hypertension, diuretics. Question 30. A nurse cares for a preschooler with suspected epistaxis, nosebleed. What is the best immediate action? A. Tilt head back and pinch nose. B. Tilt head forward and apply pressure to nose. C. Place child in supine position with ice on forehead. D. Insert tissues into nostrils. Answer: B. Tilt head forward and apply pressure to nose. Rationale: tilting forward prevents blood aspiration and swallowing. Pinching the nose for 10 minutes helps stop bleeding. Tilting back increases risk of aspiration. Supine positioning and tissue insertion are unsafe. Strategy: for bleeding questions, Nclex wants the answer that both controls bleeding and prevents aspiration. Question 31. A 3-year-old is admitted with suspected epiglottitis. Which action should the nurse take first? A. Prepare for intubation. B. Obtain a throat culture. C. Start 4 antibiotics. D. Administer oral fluids. Answer: A. Prepare for intubation. Rationale: epiglottitis is a medical emergency caused by inflammation of the epiglottis, often due to Haemophilus influenza type B. The biggest danger is airway obstruction. Throat cultures or using a tongue depressor can cause complete airway closure. Fluids are delayed until the airway is secure. Strategy: when you see epiglottitis, think airway first. Never insert anything in the throat until intubation is ready. Question 32. The nurse teaches parents of a 9-month-old about injury prevention. Which statement shows the need for further teaching? A. We will keep small toys and foods like nuts out of reach. B. We can leave him in the bathtub for a minute if the phone rings. C. We will keep medicines locked in a cabinet. D. We will secure gates at the top of the stairs. Answer: B. We can leave him in the bathtub for a minute if the phone rings. Rationale: infants can drown in just a few inches of water within seconds. Parents should never leave an infant unattended in the tub, even briefly. Strategy: for safety questions, pick the option that eliminates the highest immediate risk of death, choking, drowning, suffocation. Question 33. A 14-year-old with cystic fibrosis is admitted for a pulmonary exacerbation. Which intervention is most important? A. Administer pancreatic enzymes. B. Provide postural drainage and chest physiotherapy. C. Encourage a high-calorie, high-protein diet. D. Monitor blood glucose. Answer: B. Provide postural drainage and chest physiotherapy. Rationale: in CF exacerbations, the priority is airway clearance to remove thick secretions and improve oxygenation. Pancreatic enzymes and high-calorie diets are important but not immediate priorities during an acute pulmonary crisis. Blood glucose is monitored only if the child has CF-related diabetes. Strategy: when the STEM mentions exacerbation, focus on the acute problem first, airway clearance. Question 34. A nurse is caring for a 7-year-old with acute rheumatic fever. Which finding is most concerning? A. Joint pain and swelling. B. Rash on the trunk. C. Irregular heart rate with a new murmur. D. Fever of 38.5 degrees Celsius 101.3 degrees Fahrenheit. Answer: C. Irregular heart rate with a new murmur. Rationale: rheumatic fever can cause carditis, leading to permanent valvular damage. A new murmur with irregular rhythm indicates serious cardiac involvement. Joint pain, rash, and fever are common but less life-threatening. Strategy: when Nclex asks, most concerning, pick the finding that indicates organ damage or life-threatening complication. Question 35. The nurse is assessing growth in a 24-month-old toddler. Which milestone should the nurse expect? A. Uses 2 to 3 word phrases. B. Knows colors and shapes. C. Copies a square. D. Balances on 1 foot for 10 seconds. Answer: A. Uses 2 to 3 word phrases. Rationale: by 2 years, toddlers typically combine words into simple phrases, walk independently, and have a vocabulary of 200+ words. Recognizing colors/shapes and copying a square are preschool milestones. Balancing on 1 foot is usually around 4 years old. Strategy: Nclex loves milestone questions. Anchor ages. 1 year walk with support, 1 to 2 words. 2 years 2 word phrases. 3 years tricycle, 3 word sentences. 4 years square, hop. 5 years triangle, skip, tie shoes. Question 36. A child with leukemia develops a fever of 39 degrees Celsius 102.2 degrees Fahrenheit. What is the nurse's priority? A. Administer acetaminophen. B. Notify the healthcare provider immediately. C. Sponge the child with lukewarm water. D. Recheck the temperature in 30 minutes. Answer: B. Notify the healthcare provider immediately. Rationale: children with leukemia are often immunocompromised due to chemotherapy. Fever is a medical emergency because it may indicate sepsis. Antipyretics mask the problem. Strategy: with oncology patients, fever equals infection until proven otherwise. Call provider immediately. Question 37. A nurse is caring for a 4-year-old with nephrotic syndrome. Which finding requires immediate intervention? A. Periorbital edema. B. Proteinuria. C. Decreased urine output. D. Respiratory distress. Answer: D. Respiratory distress. Rationale: nephrotic syndrome causes protein loss, edema, fluid overload. Respiratory distress may indicate pulmonary edema or pleural effusion, which is life-threatening. Periorbital edema, proteinuria, and decreased urine are expected findings. Strategy: when Nclex asks for the priority finding, choose the one affecting airway or breathing over expected disease signs. Question 38. The nurse cares for a child who just had a tonsillectomy. Which assessment finding is most concerning? A. Refusing to drink fluids. B. Complaints of throat pain. C. Frequent swallowing. D. White patches in the throat. Answer: C. Frequent swallowing. Rationale: frequent swallowing indicates bleeding at the surgical site, which may lead to hemorrhage. Pain and refusal to drink are expected. White patches are normal healing tissue. Strategy: post-op tonsillectomy Nclex keyword equals frequent swallowing equals bleeding. Always choose this. Question 39. The nurse is planning care for a 10-year-old with type 1 diabetes. Which activity is most appropriate for promoting independence? A. The nurse checks the child's blood glucose before meals. B. Parents draw up insulin while the child watches. C. The child performs fingerstick blood glucose monitoring with supervision. D. Parents administer all insulin injections. Answer: C. The child performs fingerstick blood glucose monitoring with supervision. Rationale: by school age, around 9 to 11, children can take responsibility for self-care tasks with supervision. This builds independence and prepares for lifelong self-management. Parents should still supervise insulin administration. Strategy: Nclex looks for the developmentally appropriate independence that promotes autonomy but keeps safety in mind. Question 40. A 6-year-old is brought to the ER after a seizure. The child is postictal and drowsy. What is the nurse's priority? A. Document seizure activity. B. Place the child in side-lying position. C. Apply oxygen via nasal cannula. D. Allow the child to sleep undisturbed. Answer: B. Place the child in side-lying position. Rationale: after a seizure, children are at risk for aspiration due to decreased consciousness. Side-lying position maintains airway patency and prevents aspiration. Documentation and oxygen can follow once the airway is safe. Strategy: postictal care always prioritizes airway and positioning. Side-lying is the correct Nclex answer. Question 41. A 2-year-old with Kawasaki disease is being treated with 4-immunoglobulin, IVIG, and aspirin. Which finding is the most concerning? A. Irritability and fussiness. B. Fever of 38.1 degrees Celsius 100.6 degrees Fahrenheit. C. Decreased urine output. D. Sudden chest pain. Answer: D. Sudden chest pain. Rationale: Kawasaki disease can damage the coronary arteries, leading to aneurysms or myocardial ischemia. Sudden chest pain is a red flag for cardiac involvement and is life-threatening. Irritability and mild fever are common, and decreased urine output can be monitored, but chest pain demands immediate action. Strategy: when you see Kawasaki disease on Nclex, always prioritize cardiac symptoms over everything else. Question 42. A 5-year-old in skeletal traction for a femur fracture is being assessed. Which finding requires the nurse's immediate intervention? A. Mild discomfort in the affected leg. B. Slight swelling around the pin site. C. Absent pedal pulse in the affected leg. D. Refusal to eat lunch. Answer: C. Absent pedal pulse in the affected leg. Rationale: an absent pulse indicates circulatory compromise, possibly from compartment syndrome. This is a medical emergency. Mild pain, swelling, and appetite changes are expected and do not indicate imminent danger. Strategy: in fracture/traction cases, always check the 6Ps, pain, pallor, pulselessness, paresthesia, paralysis, pressure. Loss of pulse equals top priority. Question 43. A child with acute lymphoblastic leukemia, ALL, is scheduled for a lumbar puncture. Which parent statement shows correct understanding? A. This test will check for infection in the brain. B. This test allows chemotherapy to be given into the spinal fluid. C. This test will cure my child's cancer. D. This test is only needed once. Answer: B. This test allows chemotherapy to be given into the spinal fluid. Rationale: in ALL, a lumbar puncture is used both to detect CNS involvement and to administer intrathecal chemotherapy. It does not cure cancer and may need to be repeated during treatment. Strategy: on Nclex, look for the true purpose of diagnostic and treatment procedures rather than myths or false hopes. Question 44. The parents of a 6-year-old with nocturnal enuresis ask for advice. Which instruction is best? A. Punish the child after each accident. B. Limit fluid intake before bedtime. C. Wake the child every 30 minutes at night. D. Restart toilet training from the beginning. Answer: B. Limit fluid intake before bedtime. Rationale: classic signs of TEF are the 3 Cs, coughing, choking, and cyanosis during feeding. These signal life-threatening aspiration risk. Small regurgitation, sleepiness, and hiccups are not as critical. Strategy: memorize, TEF equals 3 Cs. If you see it in the stem, think aspiration emergency. Question 46. A 16-year-old with type 1 diabetes has nausea, vomiting, fruity breath, and deep rapid breathing. What is the nurse's first action? A. Administer 4 insulin. B. Start 4 fluids. C. Test urine for ketones. D. Give antiemetic medication. Answer: B. Start 4 fluids. Rationale: these are signs of diabetic ketoacidosis, DKA. The priority is fluid replacement because the child is severely dehydrated. Insulin is given only after fluids are started to prevent shock and cerebral edema. Strategy: DKA sequence: 1. Fluids 2. Insulin 3. Electrolytes. Nclex loves to test this order. Question 47. A child with suspected meningitis is admitted. What should the nurse do first? A. Administer 4 antibiotics. B. Place the child on droplet precautions. C. Obtain a lumbar puncture. D. Give acetaminophen for fever. Answer: B. Place the child on droplet precautions. Rationale: meningitis is highly contagious. The priority is infection control to prevent transmission. Antibiotics are started after cultures are drawn. Lumbar puncture confirms diagnosis but precautions come first. Strategy: in infectious disease cases, Nclex wants you to remember, isolate first, treat second. Question 48. A 7-year-old receiving chemotherapy develops stomatitis. Which intervention is best? A. Use lemon swabs for oral care. B. Offer soft, bland foods. C. Provide a firm toothbrush. D. Encourage spicy foods to improve appetite. Answer: B. Offer soft, bland foods. Rationale: stomatitis causes painful mouth ulcers. Soft, bland foods reduce irritation and allow adequate nutrition. Lemon swabs, firm toothbrushes, and spicy foods worsen mucosal injury and pain. Strategy: for chemotherapy side effects, gentle oral care plus bland diet plus pain control are always correct. Question 49. At a 12-month well-child visit, which finding should concern the nurse? A. Using a pincer grasp. B. Saying mama and dada with meaning. C. Walking independently. D. Not tripling birth weight. Answer: D. Not tripling birth weight. Rationale: by 12 months, infants should have tripled their birth weight. If not, it suggests delayed growth or nutritional issues. Pincer grasp, walking, and first words are appropriate milestones. Strategy: memorize growth rules. Birth weight doubles by 6 months. Birth weight triples by 12 months. Question 50. A nurse prepares to give vaccines to a 4-year-old. Which parent statement needs correction? A. My child had a mild fever after the last vaccines. B. We will hold her firmly during the injection. C. She should not get vaccines because she had a mild cold yesterday. D. She may cry, but it will be quick. Answer: C. She should not get vaccines because she had a mild cold yesterday. Rationale: mild illness, such as a cold or low-grade fever, is not a contraindication to vaccination. Only severe illness, high fever, or allergic reaction requires delay. Strategy: on Nclex, watch for vaccine myths. Remember, mild illness is not equal to contraindication. Great job making it all the way through these 50 must-know pediatric NCLEX questions. Party popper, every question you master brings you one step closer to passing the NCLEX with confidence. If you found this video helpful, make sure to hit that like button and subscribe so you don't miss our upcoming NCLEX practice videos. And if you want to keep building your knowledge right now, I highly recommend watching my video on top 15 Nclex OB/maternity questions you can't miss. It's packed with high-yield content that pairs perfectly with what you've learned today. I'll see you in that video, and remember, you've got this. Passing the NCLEX is absolutely within your reach.